Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers, producer of Public Health on Call. And for 2 years, we've brought you COVID-19 and public health news. But the podcast is just one of the ways you can learn more about the evidence and experts from the Johns Hopkins Bloomberg School of Public Health. If you like what we've been doing on the podcast, please consider subscribing to our e-newsletter, Expert Insights, which publishes on Tuesdays and Fridays. The newsletter contains the latest on how we're working to understand, manage, and eventually end the COVID-19 pandemic and prepare us for future outbreaks. We also cover the school's groundbreaking research and insights on climate change, mental health, racism, opioids, gun violence, and more. You can find our work at publichealth.jhu.edu/subscribe. That's publichealth.jhu.edu/subscribe. We so appreciate you being part of our public health community. Today, we have a very special guest, Alice Benjamin, a family nurse practitioner and chief nursing officer at nurse.org. She is the host of the Ask Nurse Alice podcast, and today she speaks to our own Dr. Josh Sharfstein about the state of nursing in the U.S. Let's listen.
It's my great pleasure to welcome Nurse Alice Benjamin, otherwise known as Nurse Alice, to the Public Health on Call podcast. Let's start with a basic question. Tell us about your career in nursing.
Yes, thank you first for having me. It's my pleasure to join you. I have been a nurse for over 23 years, worked primarily in critical care, emergency room, in the hospital setting. Over my career, I became an advanced practice nurse. So I am a cardiac clinical nurse specialist. So I still work in the hospital and with that role. And then I also, as a family nurse practitioner, do work at a federal COVID testing site.
Now, you also have a podcast called Ask Nurse Alice. Tell us about how that podcast works.
Yes. So I'm one of the hats that I wear that I failed to mention there was I'm chief nursing officer at nurse.org. So I've been able to use media and social media as a platform to share important messages, especially those to nurses. And so nurse.org and I work together, and they present the Ask Nurse Alice podcast, where I share about two podcasts a week talking about very important issues for nurses and other healthcare professionals and those aspiring and friends of nurses.
So would it be fair to say that you have your finger on the pulse of nursing? And if so, what are you reading from that pulse?
Yes, I definitely have my finger on the pulse. And in the roles, in my nursing profession and career, I've always had worn a hat of educator and someone who, especially as a clinical nurse specialist, had one foot at the bedside and one foot in the boardroom. So I have been able to, fortunately over the years, been able to take important messages and directives that come from the boardroom and help nurses at the bedside implement those things. And I can say these last 2 years, almost 3, I believe now, with COVID has been very, very challenging. I know the nurses, they love being nurses, they love taking care of people, but they are definitely not all feeling okay about things. A lot of nurses are frustrated, they're feeling not appreciated, overwhelmed. Moral distress is very high. And so nurses love being nurses, but there are a lot of things that I believe that we need to do in the nursing profession to retain our nurses doing the work that they're doing.
So tell me a little bit more about the challenges. I mean, we've certainly heard about just how many patients there have been during COVID. What else has contributed to this crisis for nurses today?
Well, in addition to the increased demand and higher acuity of nursing, even before COVID, we knew that there was a nursing shortage on the horizon because, things like healthcare reform have allowed more people to have access. People are living longer with more medical conditions. We've had a shortage of nurse space in nursing schools due to a shortage of nursing educators and as well as a shortage of training sites, clinical sites. And so we had that, and then you couple that with the demand of this world pandemic, and it has really created devastation. And also take into mind that we have people who are nurses that are naturally going to retire, but due to all of these work conditions, it was very scary. It has been very scary on the front line. We have a lot of nurses who've not been nurses for very long who are wanting to leave the profession. And it's sad because they want to take care of people, but there are some work conditions that really decrease the pleasure, make it less desirable to want to be a nurse.
So what are those work conditions that you're talking about?
Well, again, we're more patients, higher acuity, less resources. We're short-staffed with nursing, so not enough nurses to actually do the work, not feeling appreciated. And, there's the concern and fear of COVID, because even though we are nurses and we're taking care of people, we are consumers of healthcare too. We're just as likely to get sick, and we're putting ourselves in positions where our probability of getting exposed is very high. There's been the frustrations with vaccines. And just as some of the public has had mixed feelings about getting vaccinated, we have our share of nurses who've had those same feelings. So, even healthcare administrators have had to sometimes furlough or release staff, nurses who have not wanted to get vaccinated. So you take all of these things coupled with the mental health and the concern about getting sick with COVID, our family members are getting sick with COVID, and the fear of dying, which many people had, especially during the height of the pandemic. All of those things have been the perfect storm for some nurses wanting to leave the bedside.
You mentioned that the lack of appreciation is an issue. I know that the way that the pandemic has been politicized, where people may not even believe that they're sick with COVID or are angry at the people taking care of them, is that something that you put in that category of not appreciated? Is there something different about the lack of appreciation these days compared to maybe in times past?
Yes, I will say this. When the pandemic first started, and nurses, we're very much unsung heroes. We're never really looking for praise or thank yous. But at the time, when the pandemic first started, there are a lot of thank yous to nurses for the work that they do, and as well as other frontline healthcare workers. And over the time, as the demand increased, there were frustrations around how the pandemic was being handled when it came to, messages from the CDC, isolation, vaccines, and nurses. We are the messengers. We are, looking at the evidence and the research that's shared with us, the standards of care, and we are applying those to help keep everyone safe. And oftentimes we were kind of the middle person caught between the general public and maybe, other authoritative bodies who were packaging these messages, for example, in the CDC. And oftentimes we were getting the brunt of the dissatisfaction that the public was getting because, we were kind of chasing our tail during COVID. We'd get new information and something would change, mask on, mask off, vaccines, this, that, they're coming, they're not coming, who should get it? And I think as nurses, we were caught in the middle of so many different messages being released every day that we were getting very frustrated. Public was getting frustrated with us. And then healthcare administrators, those in the C-suite, needing to keep operations going. But then it was like squeezing us. It's like you're going to make orange juice, but at some point you're going to run out of juice. Well, you can only squeeze that orange so much before there's nothing left. And as nurses, we were still trying to, do the work when we ourselves were even depleted. And that was just something that was just very frustrating to us. We want to do the best job that we can do, but not getting the thank yous and not even being told, we're sorry that you're having to experience the brunt of this. And help us work through those challenges. It just wasn't happening.
So you've got a workforce that is depleted, in some cases demoralized, underappreciated. What do you see as the solutions for nursing?
Well, I think there's a lot that needs to be done when it comes to helping to repair what's already happened due to the pandemic and actually try to get a handle on this nursing shortage that even if when the pandemic starts to we get back to normal, we're still going to have to deal with this nursing shortage. And I think it's a few things. So, and at nurse.org, I'll say this, we actually did a Future of Nursing report where we actually surveyed over 1,500 nurses about how they were feeling during this pandemic. whether they wanted to stay, leave, what would be required for them to stay. And some of the most common things that we saw in that report is that nurses were desiring higher pay for the work that they were doing. We need to make sure that we have safe nurse and patient ratios. Not all states have staffing ratios. California, where I live, we do have them, but during a state of emergency, those are out the window. And there just weren't enough nurses to provide the care. Some nurses were really concerned with hazard pay. We had some nurses who were thrusted and only worked in COVID units. That was something that we heard our nurses ask for, as well as mental health sources. And not just during this pandemic, but I think this is something that overall is needed. We as nurses are dealing with multiple patients, multiple personalities, multiple conditions. And yes, while we're helping others, we hold on to that at the end of the day. We're exposed to that. So we as well need mental health services for ourselves. And then also, when it comes to the pipeline and keeping nurses in the profession, or even replacing those who actually retire or leave, we need to have a better pipeline of how we are going to train and educate future nurses, how we're going to transition them, and how do we keep them retained and provide them the knowledge and the training. Because during the pandemic, we had several nurses who were not ICU nurses or critical care nurses. Although they were great nurses that could provide a majority of the care, they weren't trained on ventilators. They weren't trained on some of these hemodynamic drips and other therapies that critical care and ICU nurses, or critical care ICU ER nurses had. So we have to think of a better way of how we can keep our nurses supported and knowledgeable so they feel comfortable and safe providing the care that's required.
Yeah, I mean, it's a challenge. And in a sense, what you're saying is you need more nurses for the conditions to get better for nurses.
Absolutely.
But the problem is it's hard to get more nurses given where the conditions are.
Yes.
So that's a little bit of the hole that you're in, and really investing in the pipeline, bringing more people through, and hopefully being able to have more nurses to fill these roles is a really urgent step.
Yes. And if I can just add to that, even before the pandemic, over 80,000 applicants are turned away from nursing schools due to a lack of space in clinicals or in the actual program because of the shortage of instructors. So that's one thing. So we definitely need more to support our nursing education and schools, but also with this pandemic, it's also opened the doors to more than just what happens in the hospital. We've had an increased demand for public health nurses and services for people at their homes. So, even though we've had a demand in the hospital, we've actually increased the number of roles that we need nurses in to provide care to our citizens.
Well, that's a really important point. And I can say from the public health side, the enormous demand for hospital nurses has actually pulled nurses away from public health roles, like school health, for example, leaving the public health system in trouble. So this is a crisis that really has a lot of different effects, both within and outside the medical care system.
Yes, absolutely. And it's something that, we really need to get a handle on because, again, we had a nursing shortage pre-pandemic. This pandemic has really shown the light and exacerbated many of the conditions that are making it worse. And, the needs for nurses is only going to increase. So it's going to be very important that we look at replenishing our workforce.
So what do you say to nurses who are wavering? They have worked their career, on the front lines, but this has been just a brutal experience for them and they're ready to go for something else, or at least they're thinking about it. I'm sure you run across nurses like this. You are, a nursing leader communicating to many nurses on a regular basis. What do you tell them?
That is an interesting question. And it's hard to answer that because I obviously would say, we really want to keep you in the nursing profession. We need great people like you, but everyone can reach the end of their rope. And you have to think about it. Yes, they are nurses. We need them and we want them to help provide a service, but they also have, have other obligations. The nursing profession is majority women. Many of these are mothers caring for their families. And so, you can be torn in that decision. But what I would say to anyone who is wavering, leaving the nursing profession, that perhaps it's not necessarily leaving the nursing profession, but perhaps finding a different role within the profession. But then also please take time to consider mentoring and helping to educate nurses of tomorrow, because we definitely are a shortage of nursing educators. So if you're someone who's worked the ICU, worked the ER, it's too much for you and you're looking for something a little bit different, perhaps that's education. Let's take that wonderful nursing experience and all that knowledge and experience you have, and let's help to educate future nurses. But I think there's plenty of work out there. If you're a nurse, you don't necessarily have to leave the profession to do something different, but maybe it looks a little bit different in where you work. Maybe it's public health, maybe it's in the schools, maybe it's, doing remote telehealth. But we definitely want to keep our nurses in it. People are concerned, like, is this the right profession? Should I still become a nurse? Absolutely. Absolutely. We need you. We want more nurses to come into the profession to take care of people, but we also want nurses to help to solve this nursing shortage, this nursing problem. And it's not until we hear the voice of the nurse as far as what work conditions do you want to see that will make it pleasant enough for you to stay. We have a lot of outsiders telling nurses what we should be doing, but we really need to look within to see for nurses to make the changes and create the conditions in which they want to work in.
Well, Nurse Alice, you're tremendous voice for exactly that. So thank you so much for joining us on Public Health On Call.
Thank you for having me.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.